How does infection prophylaxis work for kidney transplant patients? Have you ever wondered how kidney transplant patients stay safe from infections after their surgery? Infection prophylaxis is a crucial part of their care. It involves strategies to reduce the risk of infections, which can be serious due to the medications that suppress the immune system. These medications help prevent the body from rejecting the new kidney, but they also make it harder for the body to fight off infections. One key aspect of infection prophylaxis is understanding the risk of infections. Kidney transplant recipients take immunosuppressive drugs, which lower their immune response. This means they are more vulnerable to infections from bacteria, viruses, and fungi. The goal of prophylaxis is to find a balance between preventing organ rejection and minimizing the risk of infections. Antiviral prophylaxis is particularly important for preventing infections like Cytomegalovirus or CMV. This virus can be a serious threat to kidney transplant patients. To combat this, doctors often prescribe antiviral medications, such as intravenous ganciclovir or oral valganciclovir, during the first few months after the transplant. There are two main strategies for this. Universal prophylaxis, where all patients receive antivirals, and preemptive therapy, where doctors monitor viral levels and only start treatment if the virus is detected. Bacterial infections are another concern, especially urinary tract infections. To prevent these, doctors may prescribe antibiotics in the early days after the transplant. However, they usually avoid long-term antibiotic use to prevent antibiotic resistance. A common choice for preventing certain infections is trimethoprim sulfamethoxazole, which helps protect against pneumocystis jirovecii pneumonia and other bacterial infections. Fungal infections can also pose a risk, particularly for patients with additional risk factors. In some cases, antifungal medications may be given to high-risk patients during the early post-transplant period. Infection control practices play a vital role in overall safety. This includes strict hygiene measures, environmental controls, and minimizing exposure to infections in healthcare settings. Regular monitoring is essential, too. Doctors conduct clinical evaluations and laboratory tests to catch infections early. For instance, testing for viral loads helps ensure timely treatment adjustments. It is important to remember that while prophylactic treatments are beneficial, they can also have side effects. For example, antiviral medications can cause bone marrow suppression, and prolonged antibiotic use can lead to resistance. Therefore, healthcare providers carefully design prophylaxis regimens to maximize benefits while minimizing potential harm. In summary, infection prophylaxis for kidney transplant patients is a comprehensive approach. It combines immunosuppressive management, targeted medications, infection control measures, and vigilant monitoring. This strategy is essential for maintaining kidney health and reducing complications that could threaten the success of the transplant. If you or someone you know is a kidney transplant patient, always consult healthcare professionals for personalized advice and care.